From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. It's a positive development in a grim trend that we rarely talk about. Across Colorado, fewer pregnant women and new moms are dying from accidental overdoses. The number of maternal overdose deaths dropped from 20 in the year 2020 to 8 just 3 years later. That's a 60% reduction in the most recent years for which data is available. Why it's happening isn't totally clear, but a doctor who specializes in addiction treatment during pregnancy has a theory that involves naloxone. That's an over-the-counter medication that can stop or reverse the symptoms of an overdose by people who use opioids, including heroin or some painkillers. Naloxone has become more widely distributed in recent years, but it's not without controversy. Proponents say it saves lives, while some feel it enables or perpetuates drug abuse. Dr. Kaylin Klee, who's an associate professor of family medicine at CU Anschutz Medical Campus, thinks naloxone is behind the decline in overdoses. She wrote about her hypothesis and what it says about how we address addiction in a recent piece for the website The Conversation. And we should note that she's a member of groups that advocate for and receive funding to support wider availability of naloxone, and that this conversation will touch on suicide. You have an unusual medical specialty. You treat moms who are also drug users. Give us a glimpse of what you would say to a mom who visits your office and says, I am 2 months pregnant and I use opioids regularly.
That would be a very common patient scenario for me, which unfortunately, I don't think it should be an unusual practice. I wish there was more comfort and education about taking care of people during pregnancy with substance use.
Mm-hmm.
Substance use in pregnancy is probably as common or more common than diabetes, high blood pressure, things that we frequently screen for and discuss with newly pregnant or even immediately postpartum patients.
Wow.
And so my conversation with patients is often, how is this pregnancy going for you? How are you feeling in general? And where are things at for you with opioids or other substance use? And how can I help talk about that with you today?
So very accepting, not judgmental, it sounds like.
I hope so. That would be my goal.
I was surprised to read that accidental overdose is one of the top 2 causes of death for pregnant people in Colorado, along with suicide. Why don't we hear about this more?
I think it's a difficult topic that suicide and accidental overdose are not spared from some of our most vulnerable and cherished people in our community, including parents, pregnant moms. Pregnancy can be a very special time, but it is not a magic cure for mental health or substance use conditions. And so possibly one of the reasons that we see this trend continue, not just in Colorado, but nationally, is that we haven't gotten to the place of being able to speak more openly and pragmatically about how do we assess for suicide risk, how do we assess for substance use in pregnancy, and what can we do to prevent harm coming to a person who may be struggling.
Your article in The Conversation says you think naloxone is causing this 60% decline in maternal overdose deaths in Colorado, but it is hard to prove a negative. How confident are you that naloxone is the cause?
That is a very nuanced question. You are correct. It is very hard to prove that something has been prevented by one factor.
Right.
I believe naloxone, based on the public health data we have in communities at large, is one tool that helps reduce overdose death. And so as pregnant people are part of the general community as well, I believe that providing naloxone to pregnant, postpartum, and parenting people is going to help decrease overdose deaths in the community in general, as well as in this targeted population.
Dr. Klee, one thing you discuss is that accidental overdose deaths in this statistic includes women who are not habitual users, who were simply prescribed opioid painkillers after giving birth. How common is that?
Thankfully rare for people who are opioid naive, have a surgery, and then prescribed opioids to go home from that hospitalization and have an overdose event. The most important thing about this data showing overdose as a driver of maternal mortality is that we've taken great care to be able to separate accidental overdose from suicide. And so what we see represented is really people who did not mean to harm themselves, who didn't mean to have an overdose event. And that could be people with substance use disorder, who are definitely the highest risk population.
Right?
It could be people with chronic pain who accidentally take too much of a prescription medicine. And it could include, in not maternal data, but in pediatric death data, children who accidentally find a stray pill on the floor. And so I want naloxone to be available for any and all situations in which a person could be exposed to a medicine or substance that impairs their ability to breathe.
Naloxone, as I mentioned in the intro, is controversial. Some people think it perpetuates addiction or drug use. How do you think your theory that naloxone is saving lives should influence what the public thinks about this issue?
Sure. I hope that we're seeing some movement in what we think of as harm reduction in general. Harm reduction is not only naloxone, it's not only providing sterile supplies to people who use substances. Harm reduction is really a philosophy of care that helps pragmatically assess the risk to a person that has a general condition and work to reduce the harm that could come to them. This is the approach we take with sunscreen and skin cancer. This is why there's seatbelts in cars, right? So that if worst thing happened, in the worst case scenario of a dangerous event, you have some protection already in place. And that's how I think about harm reduction for people who use substances too. Putting seatbelts in cars did not make people drive more dangerously. And giving naloxone to people who could be at risk for overdose death does not, in the data, demonstrate that people use more substances or use in a riskier manner. It just means that more people have the opportunity to continue to live their life, to parent, and to hopefully be able to experience a life of sobriety and recovery.
Dr. Kaylin Klee examined how naloxone may be leading to fewer accidental overdose deaths for pregnant women and new moms. We'll put a link to her essay in the conversation in our show notes and at KUNC.org. That's it today for In The NoCo. I'm Erin O'Toole. Thanks so much for listening.